Hello, and welcome to this session where we're going to discuss repetitive strain injuries of the lower horse in sports horses and the Farriery treatment approach, which basically relies on the manipulation of forces applied to the limb to gain a mechanical advantage. By good proportions, what do we mean? Of course, we mean the obvious things like the normal hoof pastern axis, where the line of the phalanges aligns with the dorsal hoof wall, and you have heel-toe parallelism, a good trajectory of the current from the coronary band placed forward should end at the last weight bearing point of the heel. We should have an approximate 3:1 heel-toe height ratio, and the center of rotation of the coffin joint should divide the weight bearing surface of the shoe equally in half from the point of breakover to the center of rotation, and from the center of rotation, to the last weight bearing point of the heel. These are the kind of proportions that we look at from a dorsopalmar aspect, and from a DP perspective, an axis through the center of the limb should divide the weight bearing platform equally in half with symmetrical branches either side of that weight bearing axis, as you can see here, with the fetlock descending down through the middle of the foot and in between the middle of the heels of the shoe. The ground bearing surface of the shoe should be concentric to the center of rotation of the coffin joint, with the medial and lateral aspects of the foot being equal distant from that center of rotation. We will be talking later about a point positioned approximately 3/8 of an inch back from the point of frog, commonly referred to as Duckett's dot, which represents the point of force in a well-conformed foot. This distance between the point of force and the center of rotation is important when we consider hoof shape, and we will be discussing that later on in this presentation. It is important to note that the knowledge that we're discussing here is based on science and on the shoulders of the giants that went before us, and that the contribution of fellow researchers should not be forgotten. Horseshoeing was developed over 2,000 years ago, at approximately around 400 BC, with the primary objective of protecting the foot from excessive wear during domestication. The initial concepts of protecting the foot from excessive wear expanded over the centuries to about the 10th century, where it became an iron-based shoe attached by nails, but the primary goal remained the same: to protect the horse's foot from excessive wear, to enhance its performance, and to alter and or change or effect correction to deformities of the foot. That horseshoeing methodology has stood the test of time over the centuries. Irrespective of the methodology employed, the primary goal remains to keep a balanced, symmetrical foot that enhances the mechanical features of the foot during load and is a symmetrical weight-bearing platform to protect the structures from within. Irrespective of style and or surface, the addition of grip, still the primary goal remains to keep symmetry, and where we need to protect or prevent injury from conformational defects or speed, again the same objective of a symmetrical weight-bearing platform in line with the structure of the limb is of primary importance. The difference between the styles is often related to the shoeing cycle or the period in between shoeings. There is very little new in horseshoeing history, and despite the fact that all sorts of modern appearing looking shoes have come to light in the last 20 years, most of those derivatives have been around for hundreds of years, where our predecessors have had to overcome specific problems in relationship to the work required of the horse at that time. And these are a few examples. This French therapeutic shoe from 850 AD resembles the spider shoe that we see currently. This Arabian bar shoe from the 11th century, used to facilitate horses traveling across sand to prevent them sinking too far into the sand, also resembles the wide web roller motion shoe that we see commonly used for arthritic conditions. And even to go as far as bar shoes with outer rims that are now represented by what's called a continuous clip shoe. But good horseshoeing is not just simply about good blacksmithing skills and attaching a wear plate to the bottom of a horse's foot with nails and preventing injury from that act in itself. Good farriery needs to account for anatomical considerations, the conformation of a horse, and the mechanics that are affected by that conformation and anatomical changes, as well as the work being performed and the surface over which the horse is performing that work. The horse is an integrated bodily system which is connected by tissue all the way through muscles, tendons and fascia, and what happens in one area of that horse's anatomy can affect anatomically and biomechanically the rest of the horse. In this video, we can see that the horse's movement, which is basically protraction and retraction of the limb, with the limb moving around on a single axis, is affected by the muscular attachment to the bones via the tendons, which facilitate protraction and retraction of the limb and propulsion from the rear end. You can see from this painted skeleton that that action has a direct effect on the entire anatomical structure. And farriery plays an important part in the interaction of all of these anatomical structures, both during the stance and during the movement phases. With all of the limb being an integrated system of skeletal structure and tendinous and muscular apparatus, all of the joints, both front and hind, are capable of a full range of protraction and retraction movements. The muscles that do that act in two groups and act as an antagonistic pair of prime movers. So, for example, the flexor carpi radialis and the superficial deep flexor tendon, marked in red and yellow here, flex the joint, whilst the extensor carpal radialis and the common lateral digital extensor, marked here in purple and green, excuse me, extend the joint and extend the limb forward in motion. Particularly in the forelimbs, the vast majority of soft tissue injuries occur in the lower limb, and the suspensory apparatus of the lower limb is often affected and plays a major part in absorbing shock and concussion and weight bearing. But we tend to think of the suspensory apparatus as just being the major suspensory ligament, which extends from the proximal aspect of M3 down through the limb, attaching to the proximal sesamoids and then diagonally across, where it merges with the extensor tendon and attaches to the extensor process of P3. But also there's this very important and secondary suspensory apparatus that operates around the coffin joint, or the navicular suspensory ligament. Okay, the coffin joint is subjected to extremely high stress and strain during impact, load, and acceleration phases of the stride. And because of the risk of injury to the suspensory apparatus and the ligamentous apparatus within the lower limb, that's why it's important that Farriery considers the biomechanical implications of its action, because when you attach a shoe to the foot, it becomes an integral part of that bodily system. The foot is designed to absorb weight and concussion for specific periods of time during specific periods of the stance phase, which we will discuss in detail later on in this presentation. But those timings are important because they relate to the speed that the horse is traveling and therefore the amount of force that is being applied through those structures over time. Force over time equals stress and strain, which again we will discuss in some detail as we go through this presentation. But as an indication of what's happening, at the walk, the average forelimb will take up to 30% of a horse's body weight. So a 500 kilo horse will be represented by about 150 kilos being transmitted through the foot. As the horse progresses in speed to the trot at about 3.7 to 4 meters per second, the amount of force is increased and represents possibly somewhere around 100%, 120% of body weight being passed through that foot. Force is the mass of the horse times the speed or acceleration. So at the canter, that increases to 5 meters per second and is about 150% of the horse's body weight being transmitted through the foot. And at the gallop, that increases still further to 170% of the horse's body weight, or approximately 850 kilos at 14 meters per second. When jumping, as in this horse here on the right, that trailing limb will absorb up to 200% of the horse's body weight, or about 1,000 kilos of a 500 kilo horse. So it's easy to see how the internal soft tissue structures can easily be damaged, where the balance and symmetry defined earlier is not enhancing the biomechanical efficiency of the joints and those structures. Each of those soft tissue structures, tendons, ligaments, has its own tensile strength or limits of elasticity. The more strain that's placed on it, the more stress that's placed on it or weight for a longer period of time, the more the limits of strain are increased till that structure reaches its proportional limit or its elastic limit. It can stretch no more. Just beyond that, it reaches its optimal strength, at which point it starts to deform to a state where it can't return to its original shape. This is called elastomeric properties, and beyond that deformation, there's likely to be a plastic deformation or a permanent deformation, or even failure and or fracture. Whilst the joints to the lower limb are primarily designed as hinge joints to be able to effect a backwards and forwards motion, in order to be able to absorb the undulating properties of the ground surface at high speed, those joints are capable of a small amount of collateral motion or mediolateral movement in a pitch and or roll situation. But as with dorsopalmar movement, excessive motion can create strain and or stress in the joint capsule itself and compression of the cartilage, and pull and or strain of the collateral ligaments, which bind those joints together and provide them with the stability that they require to maintain their integrity over high speed. As farriers, we should discuss and understand some of the specific forces that are affecting the foot and the tissues of which we're trying to protect. Force, which is a subject of push or pull on a product of mass and acceleration. So for example, the foot being pushed or pulled creates a force. Load, which is the sum of all the forces applied to that situation. So for example, here it's easy to see that the mass of the load is far in excess of the structure's ability to be able to maintain stability about its central axis, and therefore it fails. Whilst pressure is the sum of that force applied over the area in which it is applied. So for example, the mass that we talked about of the limb applied over the ground bearing surface of the foot, and stress being the quantity of that force within the body and divided by the unit or area over which it acts. Stress takes many forms in terms of tension being pulled apart, compression being pushed together, or torsional force being twisted. The more increase of the stress that's placed in these will create that elastomeric or plastic deformation that we discussed earlier, which then leads to finally failure or loss of mechanical continuity of that structure. So for example, a tendon and or ligament injury. So in theory, the act of shoeing needs to be able to ameliorate lameness, reduce recovery times, and enhance performance by considering the manipulation of those forces that are applied. For example, ground reaction force and its vectors, any torque and or shear about the foot that creates torque or shear about the limb joints. It needs to be able to enhance the transfer of load and share load across its structure, whilst doing that to provide stabilization for the joints, support for the limb and the hoof capsule, or both together, but it is footing dependent. The surface has a major influence on our ability to be able to perform or provide this stabilization and support because of the limb's interaction with the different types of surfaces. That can be further subdivided by this grid that we talked about earlier, with two perpendicular lines down from the origin of the heel intersecting the white line. At that white line, if you drill a hole in there, you'd reach the dorsal distal tip at P3, and two diagonal lines across from heel to the intersection of the white line should meet at roughly the widest point of the sole, which represents the center of rotation of that important coffin joint, and therefore this balances out the flexor and extensor moments around that coffin joint and that navicular suspensory apparatus. But let's make no mistake about this. No matter what shoeing type of intervention that we employ, there is no substitute for good basic farriery practices, which is a shoe of appropriate size and section for the foot and the task being asked of the horse, a shoe of sufficient length, which the midline of the cannon bone ending at the last weight bearing point of the shoe symmetrical about a central axis of load, a good symmetrical outline, heel toe parallelism with good phalangeal axis, and good division of the ground bearing border about its center of rotation, and a shoe of sufficient width and length to accommodate the natural expansion and contraction of the foot whilst it is under load, the so-called hemodynamic function of the foot mechanism. But all of that is dependent on the surface over which the horse is travelling. There is not a horseshoe alive that can maintain mechanical incongruency in a surface that's this deep because of the way that it interacts. These type of surfaces are a disaster waiting to happen. Good horseshoeing is no accident. It's necessitated by having a good plan. Okay, and a good plan involves a good assessment of the horse prior to taking on the act of shoeing. In our assessment, the first thing we do is have a look at its general appearance. Does it look healthy, of decent proportions? What's its overall conformation look like? Is it well put together? Good body mass index? A history? Is there any history of lameness and or problem or injury? And then a dynamic assessment at the walk and the trot. And in both of those, we're looking for horse's natural gait, its foot flight, its tracking between front and hind limb, and its footfall. Added to which at the trot, we're looking for soundness. Okay, and we do that both in a straight line and on the lunge. Okay, and if there is lameness, if the lameness is more enhanced on a hard surface, the indications are that that may be bony or cartilage involved, where if it's more enhanced on a soft surface, the indications are that that's more likely to be a soft tissue injury. And lastly, we look at the foot and its general conformation and proportions, its hoof pastern axis, its heel toe height ratio, its mediolateral balance in terms of its symmetry about the central axis, and its dorso-palmar or its distal palmar proportions in terms of up and down, the coronary band height in relationship to the ground bearing surface and the longitudinal axis. At that point, we may go on to foot mapping so that we can develop a shoeing plan and the amount of intervention that we're going to need. There are practical considerations to take into account, not least of which is, why are we shoeing the horse? Are we shoeing the horse for increased traction because it's working on that type of surface at fast work? Okay, that determines the type of section and the profile that we might use. So in this instance, a concave shoe, which is used to give more traction. Are we shoeing the horse to augment the surface area to stop the horse from sinking into a softer surface too much? Okay, in which case that will help determine the overall profile or gauge of the section, the width of the section, how much of the foot we're wanting to engage in weight sharing, and or are we going to shoe this horse to try and ameliorate lameness, because that will help us determine the types of intervention that we may need to apply. Each of the interventions that we may apply, we need to understand the effects of those interventions, but each of them will have an unintended consequence, and we should understand those unintended consequences and try to build in mitigation of those into our shoeing plan. So, for example, increasing the surface area by the addition of a bar shoe will reduce ground pressure, but it may lead to further prolapse of the internal aspect of the foot if the hoof capsule is of a weak construction. We may want to augment that augment the surface by reducing the profile of the shoe in certain aspects to allow sinkage, but increasing the profile of the shoe in different areas to try and maintain flotation over the surface. Both of these things will have an effect on the ground pressure. Narrowing the surface increases the ground pressure, whilst widening it reduces the ground pressure. Remember that we said that pressure was a result of force over area, so the more contact area that we have, the less pressure per square centimetre. We may want to apply pressure to the caudal aspects of the foot, the heel and the frog, in order to stabilize any undue mobility within that foot because of its mechanical properties, or to enhance its functionality. And inserts like the heart bar here, which allow the frog to share the weight load normally borne by the hoof wall, will reduce the ground pressure and the foot and by increasing the foot contact area onto the shoe. We may occasionally want to remove some of that shoe to remove pressure. A good example of this is the traditional open-toed bar shoe, often seen in the use of laminitis, or even sometimes in the use of cases of pyramidal disease or arthritis of the coffin joint, to try and relieve direct pressure over that pyramidal process of P3 and the dorsal aspects of the coffin joint. We're able to manipulate these forces in terms of their location, distance and direction, all of which are changeable, because force over the time that it's over a structure within the foot equals strain. Depending on the time factor within the stance phase, that will affect different structures. So for example, here you see these pressure mat gauges impressions, where you can see that the peak pressure applied to this foot was at the toe during the point of breakover, whereas here on this foot, peak pressure was at mid-stance, which is where we would expect it to be in a normal, healthy situation. As we stated before, there are a number of considerations that we need to take into account, particularly when shoeing for pathologies. One of the most common pathologies or regions of pathology within the foot is the area around the navicular bone and the deep digital flexor tendon. So we should just remind ourselves of the anatomy of the foot. In this sagittal section here, you can see the dorsal hoof wall, the stratum internum, the lamella, solar chorea, digital cushion, P3, P2. This is the distal interphalangeal joint, highlighted here with the white cartilage around it, the navicular bone or the distal sesamoid, the deep digital flexor tendon. This orientation of the deep digital flexor tendon is particularly important, and a so-called angle of inclination. Depending on the conformational morphology of the foot, the orientation of these bones will change the angle of orientation of the distal digital flexor tendon, and that change in orientation will require more or less energy to lift the foot over into the acceleration phase of the stride. Here in between the navicular bone and the distal sesamoid is the impar ligament, the navicular collateral ligaments and the T ligament. Here you see the proximal interphalangeal joint and P1. This is the common digital extensor tendon attaching to the extensor process of P3. And you'll note that in terms of orientation, this is the center of rotation of the coffin joint falling down here. And in terms of the relationship of orientation at right angles to the orientation of the phalanges, if you come vertically underneath the extensor process, you come to the insertion of the deep flexor tendon at the semilunar crest. The point in the middle here is the point that's defined as the point of force, or if you like, you can relate that to a gearbox in a car, and this is the point of neutrality, where the effort required to extend or flex the foot is zero. So net zero effect. Underneath here, this radiograph of the navicular bone here outlined shows a common hollow-distended foci. Okay, you notice these lollipops. It's commonly used as a diagnosis towards navicular disease, but doesn't necessarily mean that that's significant. Of more significance, you can see on this MRI, is this large area here of sclerosis along the flexor surface of the distal sesamoid. This is the flexor surface of this distal sesamoid here, and you can see that the cartilage is eroded, or the flexor cortex is eroded, exposing bone. This is primarily due to ischemic necrosis, lack of blood supply, which causes the bone to erode. That erosion rubs against the medial or lateral lobes of the deep flexor tendon, which you see here, which is the thing that causes pain. You often see as well on MRI specific injuries to one or other of the tendon lobes that insert at the semilunar crest. This here highlighted on the lateral lobe. So not only do we need to account for the anatomy, but also the mechanics of how this foot works during loading and unloading. Now, the primary objectives of any Farriery treatment are to A, relieve pain, B, to enhance the mechanics and bring about a more efficient biomechanical function, and then C, hopefully to correct and or manage any of these conditions or the morphologies that occur that relate to these conditions. Clearly, in this instance of gross pathology of the navicular bone, you are not going to fix it. But we can manage the pain with an effective shoeing plan that minimizes the tension on the deep flexor tendon during load and unloading, and orientates this whole apparatus in what's considered to be a more normal or more ideal configuration. And then we can provide protection over this area by one means or another, which we will discuss as we go through the slide. The maximum strain on this area occurs during unrollment. This is a diagrammatic illustration of the stance phase at the point of enrollment, and where the foot unrolls into the acceleration phase of the stride. There's a huge effort required by the deep flexor tendon, which increases the force that's applied to it, and then decreases as it unrolls into the swing phase of the stride. To reduce this force, illustrated here by these dark blue lines, we can affect that force by the way in which we manage the toe area of the shoe. In this example here, we've got what's commonly referred to as an equilibrium toe or a roll toe on a shoe that has a raised inner border with chamfered off outer borders, which minimizes the torque forces around the foot as it unrolls into the anterior phase of the stride. Minimizing torque is also important because it reduces the strain on the collateral ligaments, and in particular the collateral and navicular suspensory ligaments coming forward. The way that we reduce this increased force on the deep flexor tendon is by moving the point of breakover further back underneath the foot. There's a misnomer that it affects the overall time phase of the stance phase. It doesn't, it just changes the time period in which it's unrolling, and I'll explain that as we go through into the slides. but by moving the point of force further back towards the center of gravity, we reduce the amount of effort that's required by the deep flexor tendon to unroll the foot into the anterior phase of the stride, which reduces the pressure directly underneath the navicular apparatus. Here we see the impression on a pressure mat of the stance phase, and it highlights the amount of time that's spent by each segment of the foot under peak pressure. The heel area is under the minimum amount of pressure because it's at 20% of the total stance phase, and you can see that very little of the horse loading occurs over the heel during that initial phase. But here in the mid-stance phase, which is approximately 60% of the stance time, okay, there is increased pressure over the surface where the foot needs to be stable, and as the horse passes over it, and then as it comes forward into the anterior phase of the stride, or the last 20% of the stance phase, that pressure is reduced until it reaches the point of breakover. The trajectory that this takes over time is known as the point of force trajectory, and it's been shown that generally speaking there's a slight lateral loading stroke loading, and then it moves towards the center. It oscillates around the center during the mid phase of the stance phase, and then quickly unrolls to the point of breakover during the anterior phase of the stride. We can manipulate that timeline by the type of shoe that we select. Now clearly, an elevated shoe will reduce the amount of tension on the deep flexor tendon. But unfortunately, because the foot is in solid contact with the floor, it actually increases the amount of ground pressure that's on the heels for a greater duration of the stance phase, which we will show in the next slide. This is a modification known as a Tennessee navicular shoe, where that elevation is broken down as a flat element for the heel loading and mid-stance phase. And then if you can imagine, as the horse's weight passes over the foot, it rocks on this fulcrum point, which is just behind the widest point of the sole or the center of rotation of the coffin joint, tipping it forward, which releases the tension on the back part of the foot, reducing tension on the deep flexor tendon. This example here is of a foot with a heel elevation, and you can see here from the impression of the on the pressure mat of the stance phase that during the total stance phase, the maximum amount of pressure, rather than being in the middle of the foot as it was on the earlier example, is now clearly defined over the heels, and that's because of the elevation and the fact that this foot is firmly planted on the floor. These heels are weight bearing for a considerably longer period of time, which increases the amount of pressure onto the heels. And then there's virtually no pressure in the middle of the foot, or no ground pressure in the middle of the foot during the mid weight bearing phase of the stance phase, because it's absorbed through the center of the foot here until the main part of the phalanges passes over the coffin joint, and it goes into flexion, where it rapidly accelerates into breakover, and then there is a peak of pressure at the point of breakover as there was before. So although it would appear that this area is now free of pressure, what you're actually seeing is only the ground contact area, in other words, underneath the shoe. This pressure that you can't see here has had to go somewhere. You can't get rid of it, and it is inside the foot here as the internal structures of this foot prolapse through the bottom because of the amount of effort and energy that's required to pick up the foot. So the force of the descending body weight is pushing down through the frog and the sole, but whilst the heels are still in contact. Okay, and then as the heels come off contact, it's released. To try and break that down a bit easier for you, this is the stance phase broken down into 4 stages. The original impact and concussion, you get a slight increase in force. That force levels out over the first 5% of the stance phase as the horizontal component or the sliding component brings the foot to a standstill. At that point, as the horse begins to move over it, the load or the force is increased until mid-stance, where the horse is immediately stood underneath it, and as the horse passes over the hoof at mid-stance, force begins to reduce until it comes to the point of breakover, where there's actually a slight increase or a spike, and then it unrolls off quickly into the anterior phase of the stride. This is the vertical force, and this is the horizontal line, okay, which shows a slight movement over the first 5% of the stance phase. It comes to a sudden stop. The stability right the way through the mid part of the stance phase, this 60% here, and then as it reaches unrollment, it begins to accelerate forward. I hope that explains that a little bit better. So what we're trying to do with the shoe that we come up with for this navicular disease or deep flexor tendons is to manipulate both this horizontal and manipulate the vertical force by manipulating the horizontal timeline. Excuse me. This is another example. You can see quite clearly here that this horse has got caudal hoof failure, weak collapsed underrun heels, loss of digital cushion mass, bulging of the collateral cartilages, contracted heels. The shoe chosen for this is a frog support shoe to enable the frog to share some of the weight off the hoof wall. You'll notice that on this shoe that it's been ground off to try and facilitate some early rollover of the shoe, or leverage reduction as it's so called, but it's also slightly tapered from the widest point of the sole. So this aspect of the shoe is flat, so during the landing and initial loading phase it's stable. As it comes into the mid stance it's stable, and as it goes past the center of as the body goes past the center of rotation of the coffin joint, it tapers off, much like the example of the Tennessee navicular shoe that I showed you. Accelerates forward to the insertion of the 2 toenails, where again it tapers off slightly and projects forward, so that what it's doing is relieving ground pressure off this heel area, not from the point of breakover, but from the center of rotation. So imagine the body passing over the foot as the body's mass goes past the center of rotation, the foot tilts forward, relieves the pressure off the heel area here, and places it firmly into the central part of the foot where it should be, and then accelerates again rapidly to the point of breakover. Also on this example, note that the frog piece is set down to accommodate the prolapsed frog. You can also see here that with the application of this shoe, there's a relief of the pressure that was on the heel bulbs, so they appear to be slightly wider. The digital cushion appears to be slightly more bulbous, and the collateral cartilages have moved to a more aligned orientation within the hoop capsule, and you can see that their extremities wrap back and will function as intended with the digital cushion. This is another example of the same thing, or the same type of thing, but in this case the frog is so prolapsed that the wool doesn't touch the ground, and because of that, and because the sole and the frog are prolapsed, the modifications had to be that we lift up the shoe to meet the underrun and damaged hoof wall. But that can be done in a different way, and the so-called self-adjusting palmar angle system, or commonly known as a banana shoe, applies the same basic principle that the foot rotates around the center of rotation, and as the horse passes forward, the weight bearing is tipped onto the front half, relieving the pressure off the back half of the foot. There is some concern that if this is too radically done, that it actually increases the tension on the suspensory apparatus during the load-bearing phase of the stride and the deep flexor tendon, because it requires slightly more effort to lift it off the initial load-bearing phase. However, in practice, the weight-bearing facility of this pushes it forward, moving the ground reaction force further forward and relieving weight off the back, off the posterior or palmar aspect of the foot. This is the shoe that I described to you earlier that we call the timeline shoe. This is just a simple open modification of it, but you can see here that the very end of the heel, or the palmar aspect of it, is slightly tapered or coined to avoid the initial, to relieve some of the initial shock at impact. The first 20-25% of the shoe's bearing surface is flat. At a point where you reaches the seater corn, or just where the bars bend, it begins to taper towards the center of rotation, relieving weight off the back of the foot. And then as it gets towards where the toenails are located, there's a further graduation which helps to relieve some of the tension at unrollment. During mid-stance, what you see is the heels firmly off the floor. So now, instead of the heels being load-bearing for 80% of the stance phase, they're now unloaded for 80% of the stance phase, which also reduces the tension on the deep flexor tendon and the amount of time that's required to help unroll the foot into the anterior or acceleration phase of the stride. So this is just to remind you again of that normal timeline, and with the timeline shoe on it, you can see that peak pressure is actually forward over the central aspect of the foot here during the load-bearing phase of the stride, as opposed to being on the heel during the last 20%, during the first 20% of the stance phase. We started out talking about navicular disease and sclerotic lesions over the navicular bone. Having sorted out the mechanics of the shoe to relieve some of the genesis of the condition, now the object of the exercise is to try and relieve pain. Some of that pain comes from compression of the deep flexor tendon against the navicular bone by descending body weight and ascending ground pressure. This is relieved by the addition of what's commonly known as a center bar fixed to the shoe just behind the widest point of the sole, covering the area of the navicular bone, which prevents any compressive force being directly applied over the navicular bone and compressing the deep flexor tendon against those sclerotic areas. Here's another example, and in this case we've used 20 Shore dental impression material to provide us with additional arch support, but sufficiently soft enough to allow a minimum amount of movement during the natural load-bearing phase of the stride, but the plate providing direct protection against external trauma. This is a really useful aid, particularly of those horses with sclerotic injuries, and in particular for horses with tendon injuries of the medial or lateral lobes of the tendon. Here is an example of the full apparatus applied to a horse with this large sclerotic area that you see on the flexor surface of the navicular bone, a full roller motion shoe or leverage reduction shoe with the central protective bar and 20 Shore dim impression material applied. Another common shoe often used for this type of injury is the shoe modification known as the spider plate, and I think it's important to highlight how the spider plate actually works. And it works similar, if you think of the foot as a round building with a domed roof on, the weight of the roof is being pulled down by gravity and is usually dispersed around the wall by the roofing pearls, which take that weight and push it around the entire circumference of the building. That, in effect, turns compressive force into tensile force. And that's exactly what happens here with the spider plate. The compressive force coming down through the limb, pushing through the foot, is met by a ground resistance which pushes it out towards the shoe. Because that's joined up with the shoe, that now becomes a tensile force all the way around the shoe's ground bearing border and reduces the amount of compression and therefore prolapse of the internal structures within the foot. This is an example of one on, and this is a horse that was barefoot for some considerable time. You can see that there's very little foot to actually trim to in order to be able to restore what we might consider normal hoof balance. Its posture is such that it's stood back underneath itself to try and relieve weight off the back of its heels because they're underrun and run forward. That creates a situation where you get flexor pull, which pulls the pastern forward, giving you this broken back hoof pastern axis appearance. This is actually postural adaptation rather than conformation. You can see from the foot here that there's little by way of correction that can be achieved through trimming. So the addition of this egg bar shoe to increase the surface area and a spider plate and some pour-in pad material to support and stabilize the palmar structures of the foot and engage them in weight sharing with the limb directly over the weight bearing surface. I'm sorry my picture's in the way here, but you can see that immediately post application of the shoe, because the weight of the horse is dispersed over a greater surface area and there's less compressive force through the center of the foot, the horse immediately adopts a more uniform posture with a good upright upper limb and a much better hoof pastern alignment. This is a good example of how force is manipulated to adapt posture to a more normal configuration and distribute load more evenly. Here's another example of a spider plate. In this case, a spider plate aluminium with a roller motion, and this was applied to a horse with coffin joint disease on the distal aspect of the coffin joint, and the additional modification is to relieve the toe area at the ground bearing border so that at the point of breakover the force is directed not centrally through the toe over the pyramidal process and the dorsal and the proximal aspect of the distal interphalangeal joint, but either side of the channel in which the P3 sits in, i.e. in between the heels. So we can imagine that this recess is the width of the heel buttress. The weight is borne on that peripheral side of P3 rather than through the center at the point of breakover. The wide toe shoe used for suspensory ligament desmopathy causes some controversy and is sometimes not really fully understood, but the object of this exercise is basically to increase the surface area over the toe, reduce the surface area at the heel to allow more flotation in an artificial surface. Now, flotation is important in an artificial surface because if you remember, we discussed that during the stance phase. At the point of initial impact, there's a horizontal component which allows the foot to slide and come to a stop as the horse begins to bear weight during the load-bearing phase of the stride, and then accelerate forward into the anterior phase of the stride. In an artificial surface, when it hits the surface, instead of there just being a horizontal component as there is on a firm surface, there's a horizontal and distal dorsal component. So it's still sinking into the ground. That sinkage creates more dorsoflexion of the fatlock joint and therefore applies more strain to the suspensory apparatus. By widening the section of the toe and increasing its surface area, you reduce the ground pressure per square centimetre of contact. That reduces the amount of sinkage. Exactly the same principle as a snowshoe, or if you remember right at the start of this presentation, the roller motion wide web shoe that the Arabs used in the 11th century to get across the Sahara Desert. Okay, so you're using this platform to reduce ground pressure in a specific place to relieve strain off a structure somewhere else. And that's the principle of wide toe, wide branch, wide heel inserts. Reducing ground pressures in a specific place to transfer it to another point of its anatomy that can best take that pressure. You cannot eliminate that force, but you can manipulate it into a different area. So this is another example of the opposite thing. This is the wide or onion heels with a narrow toe. This is often used for the same sort of thing as suspensory ligament desmotomy, but more akin to something on a firmer surface, where you want to reduce dorsoflexion by reducing ground pressure at the heel because you're on a firm surface rather than a soft surface. The same principles work exactly the same as in front as in the hind feet. This is the hind shoe with the wide onion heels for a firm surface, road work. This is the wide toe version with the narrow heels reduced in width for horses working on a softer surface. This is the front shoe with the wide toe and the narrow branches. And these videos are borrowed from the Workman Academy done by Jenny Hagen, which demonstrate the differences between an ordinary shoe in a soft surface and a broad toe in a soft surface. Oh, we can't get the videos to work. Still, we might be able to do that when we do the presentation. There we go. So here's the normal, and you can see that as it comes into the surface, instead of landing and then sliding, it lands, slides and sinks at the same time, leaving this slight elevation. You get more dorsiflexion here of the fetlock, which puts greater strain on the suspensory ligament, more effort to lift it up out of the ground. Once more. And then here on the right, you'll see with the wide toe that you get a flatter presentation of the foot as it comes into the surface. Less dorsiflexion and less effort to unroll into the foot, into the anterior phase of the stride. So this is the principle of a wide branch or the wide toe in relationship to the Farriery treatment of suspensory desmopathy when the horse is working primarily in an artificial surface. There are several ways of doing that. It doesn't have to be with a welded in insert or a handmade shoe. You can do it with the addition of pads cut out as a keyhole. This is particularly useful for horses that are working on multiple surfaces, so that in an artificial surface you've still got a similar effect, although maybe not quite as effective as direct intervention, but you've still got a much wider load-bearing surface here, particularly if impression compound or hoof filler is used underneath the pad. This is a full pad with pour-in silicone underneath. Again, for horses working on a variety of surfaces, this is quite useful. In a soft surface, fairly soon the entire foot is engaged in weight sharing, which reduces the level of sinkage. This is a method of producing this wide toe insert, but where there is a danger of prolapse of the palmar aspect of the foot through the branch of the shoe. The addition of a small frog piece to stabilize the center of the foot during the load bearing phase of the stride can be beneficial. It's particularly so on hind feet of high competition dressage horses, where they're expected to have a greater share of load bearing with the hind limbs, and on a firmer surface the hind egg bar, perhaps with the addition of a full pad, etc., etc. We take the same principle and apply that to a common diagnosis now of collateral ligament desmopathy. Just to remind you of the anatomy, P2, P3, these are the collateral ligaments. Note that they are or originate at the center of rotation of the coffin joint and attach to P3 at the insertion of the collateral cartilages. It's actually quite difficult to dissect these out from the collateral cartilages on a digital cushion in a healthy foot. This is an MRI showing the lesion here, the tear, normally here at the insertion on the anterior aspect of the collateral ligament. And the advocated method of dealing with this is the wide branch insert. It's important that this is fitted in such a position that it enhances the surface area immediately over the origin and insertion of the collateral ligament. So positioning of this is quite important. But again, the principle here is to increase the surface area over the damaged area, which in turn transfers some of the force load to the opposite side, which is better able to take it. The same 500 kilo horse is still applying the same amount of force through this foot. Okay, so you're not getting rid of force. All you're doing is changing the ground pressure or the force from one aspect and transferring it to another. It's been said that the average load around the peripheral wall is about 4.5 kilos per square centimetre. If you imagine that to be the case, by widening this branch on this, in this case the medial side, you're reducing the ground pressure to somewhere in the region of 2 kilos per square centimetre immediately, but now the ground pressure is 6 kilos per square centimetre laterally. So this is a temporary device, okay, which allows this to heal by transferring load onto the other side. So it's important that this is constantly re-evaluated and that this is removed at the opportune moment, because otherwise what's going to happen is this side's going to go. So this is not a full-time intervention. It's an intervention that just lasts for the duration of the lameness and the recovery and rehabilitation. Again, different methods of doing it. This is a pad cut out into a rim form on one side and a full diagonal piece on the other with dental impression material around it. Again, quite suitable for horses on mixed terrain, so that on a roadwork they're just weight bearing around the peripheral border of the shoe, but on mixed terrain they're able to share and transfer load in a better configuration for the relief of the injury. This is a different way of achieving a very similar thing. This is known as the ellipse or the mono-ellipse, and basically what that does, again, by inverting the shoe to follow the line of the frog and attaching it back towards the position of the nail hole, you're increasing the surface area over a much wider area, but without the additional weight. This is usually filled up with impression compound, but again, this is about increasing the surface area and reducing ground pressure, but also directing the point of force trajectory towards the point where we want the breakover to be, centrally through this channel created by the heel buttresses. Trying to think about your anatomy, this is P3, around this inner border of the shoe. The weight of the horse is immediately above it, and as the horse passes over it, should come through this channel between the heels and be directed through over the center of rotation, over the point of force, and through to the center of the foot to unrollment. This is a pressure mat impression, which shows you the differences between a normal room shoe and that with the wide branch. And you can see that in this instance, okay, there's, whilst this is, there is a much broader area of contact, so less force per square centimetre and a more orientated point of force trajectory towards the intervention. And in a normal foot, this is central. So just to remind you, the practical considerations are what each of these interventions achieves in relationship to their interaction with the ground and how they affect the anatomy and the physiology of the foot dynamically. This is a foot or a case that demonstrates really quite adequately what can be done by manipulating force. This was an eventer with a slight fracture of the medial wing of P3, which occurred immediately prior to a selection event for the Olympics. The horse was shod with a frog piece to allow the frog to take weight off the affected area, an insert into the medial aspect to broaden the surface area. This nail there is just holding in a bit of a rim pad, and so it's acting as a rivet. And because we transferred the load away from the medial side to the lateral side and got the frog to take weight, because this was all floated, the horse was immediately sound and was able to compete within 2-3 days. I'll leave you with the thoughts of my friend and colleague Leon Bentham, who has some different ideas of how to manipulate force. Okay, and if you have any questions, please raise your hand or type them into the comments box. I hope you found this helpful and informative, and I hope that it gives you a slight insight into the use of therapeutic inserts in the treatment of pathologies. Thank you very much for listening.